And when she came to me, she was very low in confidence because she had an absolutely flat chest and she was wearing layers and layers of garments to conceal that. But today in this video, I'm going to be talking about some specific cases and discuss as to how breast augmentation using either implants or fat grafting. Hi, I'm Dr.Mrinalini Sharma. I'm a plastic and cosmetic surgeon practicing in Aestiva clinic, Saket. Today we're going to be talking about breast augmentation using implants or fat grafting. Breast augmentation has been always perceived as a purely cosmetic surgery procedure, but today in this video I'm going to be talking about some specific cases and discuss as to how breast augmentation using either implants or fat grafting impacted not only the confidence of a patient but also improved her quality of life. So the first case we're going to be discussing is about a young woman, hardly 20 years old, who had underdeveloped breast. And when she came to me, she was very low in confidence because she had an absolutely flat chest and she was wearing layers and layers of garments to conceal that. So in this patient, we have performed a breast implant. Now, one thing to take into consideration when we're doing an implant in such a patient is that we should not be going for a very large size implant because that can create problems later on. So in this particular patient, we have used an implant of about 280 cc. And as you can see in the post-op picture, from an absolutely flat woman, she's got a good figure now and she has the desired proportions. This has really helped her to boost her confidence, and she came back to us very happy, saying that now finally she does not feel the need to conceal her identity or to wear clothes in layers just to have the confidence to move out of her house. Now, the second case we're going to be discussing is a woman who came to us with mild laxity of the breast following childbirth and breastfeeding. In her case, she wanted not only an increase in the size of the breast, but also she was concerned about the sagging which had come as a result of breastfeeding. Now, if you see the picture, she hardly has a significant sag. So in this case, putting a good size implant will not only give a good volume augmentation, but also will lift the breast. So in her, we just performed a simple breast implant without any kind of a lifting. We used a 365 cc implant, and as you can see in the post-op picture, not only the volume has been increased, but also the sag in the breast has been corrected. Now the third case is of a woman who has some kind of moderate breast laxity, plus she lost a lot of volume from her breast following breastfeeding. She was very disturbed by the fact, and she came to me telling me, the doctor, prior to childbirth I was a much more confident person and now somehow the clothes don't seem to fit, and she was a working professional. She told us that she's not comfortable in wearing her western outfits because they seem so out of proportion. So in her case, we have performed a combination of augmentation using a breast implant along with a traditional breast lift surgery. So this will entail putting in an implant along with removal of excess skin which has caused the breast to sag. And as you can see in the post-op picture, the body looks much more youthful and she has regained the proportions she had prior to childbirth. The only trade-off is the scar. As you see that it's in the lowermost part of the breast, and trust me, nobody minds that as a trade-off for having a lifted, youthful looking breast. The fourth case is again a patient who had a moderate amount of sagging, and as you can see in her picture, she's totally deflated. There is hardly any breast volume, plus the size of the nipple areola complex, which is called the NAC in medical terms, is very wide. This patient wanted a lift, she also wanted a volume increase, but she was not at all willing for the vertical scar which comes with a traditional breast lift. So we did some kind of a compromise in her situation, and we used implants along with something called a periareolar mastopexy, in which the lift is achieved by reducing the size of the nipple areola complex and taking away excess skin. So if you see the post-op picture, the volume has increased and the size of the nipple areola complex is also now like that of a young girl. And because of the removal of skin around the nipple areola complex, the breast is also lifted. So she was very happy. I won't say that this was the best treatment for her, but many times we have to take the patient's desires into consideration and give her the best of both worlds, where the scarring is also minimal and she achieves a good volume in the lift. Now let's talk about another indication of breast implant which is very common, and these are in people with gender dysphoria. So this picture is that of a trans woman who wanted a more feminine looking body, and so as a part of a gender reassignment surgery, we have put in implants into her. As you notice, she is a very broad shouldered woman, and in her case we've used large breast implants about 450 cc in size, and the results which you're seeing are at about 10 days post surgery. And as you notice that the large size implant complements her large body frame, and again this also improves the feeling of gender dysphoria, and patients who belong to the trans community are really happy. They feel more like a woman once these procedures have been done, and it really adds to the mental well-being of the patient. Now breast augmentation is also done using fat, the body's own fat. Many people come to me telling that, doctor, I've heard that implants are not safe, implants can cause cancer, and they are looking for some alternative options, and they have read about fat grafting on Google, and they ask me whether that's something which can be done in their case too. Now I'll show you some examples of cases where we did a breast fat grafting, but first of all we need to understand that this is not a procedure which is suitable for all the patients. In fact, there's a very select population where breast fat grafting can help. So the first picture is of a young girl. She's in her late 20s and has a good volume breast. All she wanted was a better cleavage area. So she wanted some kind of an upper pole fullness, as we call it in medical terms. She was okay with the cup size not being greatly increased. She said that even if I have a cup size increase of say just 1 cup size, it's absolutely fine by me. And another thing which a patient who is considering breast fat grafting should understand is that this is done in sessions. So she was also ready for the sessions, the 2-3 sessions which would be required to achieve the ideal volume. And in the series which follows, you can see the result after 1 sitting and after 2 sittings. And you see that compared to the pre-op pictures, in the post-op picture now she has a good volume in the upper pole and there are no obvious scars. That is one big advantage of using fat versus implants, because fat is put using tiny cuts which are hardly 3 mm. Usually they are hidden in the line of the armpit and are barely visible. And again, this patient was exceptionally fair also, so the scars heal beautifully and there are no telltale signs of any kind of breast augmentation having been done. Now the second case where we can use breast fat grafting, as is shown in the second picture, is when there is an inherent asymmetry. So this is again a young girl, she is about 25 and she has lived all her life with this complex that her breasts are asymmetrical. So in this case, the volume was perfectly fine on one side and there was a small hypoplastic breast on the other side. Again, she was not interested in an implant. She'd come in with her parents and the parents were apprehensive of getting an implant done at such a young age. So we counseled them regarding fat grafting, and as again she's an ideal candidate, she has tight skin, she doesn't have the problem of sagging. So we have counseled her for 3 to 4 sittings of breast fat grafting, because in such cases you can't put too much volume, there is hardly any skin available for expansion, you have to take it slow so that your fat survives. And the above results are just at the end of 1 session, and you can see that she has achieved a great deal of improvement from just 1 session. Again, the same advantages, she's a young girl, implants, if she had to undergo implants, that would leave a visible scar, and that might lead to problems later on in her marital life, since she's just about 18. And again, implants would need to get changed once in every 10 years. So considering all those factors, the scarring, the age of the patient and the requirement of the patient, we chose breast fat grafting as an option against using implants. Now the third case which I'm going to show you is of a patient who has again had a massive weight loss. She had lost almost 30 kgs of weight by diet and exercise. She has a lot of sagging. Ideally what she requires is an implant with some kind of a lift, and in her case she would honestly require a traditional vertical scar breast lifting. But she was very scared, parents were absolutely against getting an implant done. So we counseled her saying that okay fine, we can give you some results, but don't expect the kind of results you would get from a traditional implant with a breast lift, also known as the implant mastopexy. So in this girl we did multiple sessions of breast fat grafting, and so you can see the pictures which are at the end of the first session and also at the end of the second session. Now what's happened in this patient is that at the end of 2 sessions you can see a definite increase in the volume of the breast. Also the overlying skin seems to improve. The earlier skin texture has really improved using fat grafting, because fat is also known to improve the quality of the overlying skin. So she has had the dual advantage of some kind of a lift, also a volume augmentation, and improvement in the skin texture. Plus, she was also quite conscious about her weight, because she had really struggled to lose it. So the added advantage of doing a liposuction in the tummy and giving her a flatter tummy and using that fat to augment her breast was a really win-win situation for this girl. So this in brief summarizes how we can use implants of fat to augment the size of the breast and to correct various problems which the woman or the girl might be facing. And to summarize, this is what we have to understand, that at times it's not purely a cosmetic surgery procedure. I've seen young women being really affected by the way they look, and a properly done procedure, whether it's an implant, whether it's an implant with a mastopexy or a breast fat grafting, can do tons in improving the confidence of the woman in her daily life. I hope this video has helped in busting the myths regarding breast augmentation via implants or via fat grafting, and has cleared most of the doubts in your mind. If you found this video useful, please like it and share it with your friends. Also subscribe to our YouTube channel and press the bell icon.